Good evening, class. We're starting the maternal portion of the class and going over chapters 3, 4, 5, and 6. Assessment and health promotion, reproductive system concerns, infertility, contraception and abortion, and genetics, conceptions, and fetal development. First chapter is chapter 3, assessment and health promotion. The female reproductive system includes the external structures, the mons pubis, labia majora, and labia minora, the clitoris, the vestibular glands, vaginal vestibula, the vagina orifice, and the urethral open. Second page is the anatomy of the female external, where you'll find the mons pubis, the orifice of the urethra, and the vagina. Make sure you're aware of the female anatomy, as you will need to become aware of it when you start placing Foleys and such. In a pregnant woman, it's much more noticeable than it is in a much older lady or someone who doesn't have all the extra estrogen from being pregnant. The internal structures include the vagina, the uterus, the cervix, the fallopian tubes, and the ovaries. Here's a side view of a patient lying, showing you the structures of the internal structures. So you have the urethra, opening for the bladder, the vagina orifice for the uterus, your fallopian tubes, and your ovaries, and then the anal canal. These pictures are in your book. Make sure that you read all of your chapters, including your ATI chapters. The female reproductive system continued includes the bony pelvis, which protects the pelvic structures. It also accommodates for a growing fetus during pregnancy, and it's the anchorage of the pelvic support structures. The breast functions include lactation, and the physiologic alterations in breast size reach minimum level about 5 to 7 days after menstruation stops. This is the best time to do a breast self-exam during this phase of menstruation. Ladies, you should be doing your breast exams on yourself monthly. Menstruation, so the menarche and puberty, and the menstrual cycle include the endometrial cycle, ovarian cycle, and other cyclic changes. Menopause refers to the last menstrual period. Menopause is confirmed with certainty after a year after menstruation has ceased. The average age of menopause is 51.4 years old, but can range between 35 and 60 years old. There are several barriers to entering the healthcare system, which include financial issues, cultural issues, and gender issues. Caring for a woman across the lifespan. Prevention is number one, disease prevention. So for adolescents, it would be preventing teenage pregnancies. For young and middle adults, it would be contraception, performing pelvic and breast screenings, and also information about parenthood after age of 35. Care of specific stages of a woman's life, so preconception counseling and care, pregnancy, fertility control, infertility, and menstrual problems. The identification of risk factors. Risk factors can include social, cultural, genetic, substance use and abuse, such as prescription drug use, as well as illicit drug use, alcohol consumption, cigarette smoking, and caffeine. Nutritional risks, identification of risk factors, nutritional problems such as nutritional deficiencies, obesity, eating disorders such as anorexia or bulimia nervosa. Other risk factors can include stress, mental health conditions, patients with sleep disorders, environmental workplace hazards that would put a woman at risk, risky sexual practices, risk for certain medical or gynecological conditions, and as well as female genital mutilation, which is still prevalent today. Violence against women can include human trafficking, intimate partner violence. It can be inflicted by the woman as well, physical or emotional abuse, sexual assault, isolation, controlling all aspects of the woman's life, such as money, shelter, time, and food. The cycle of violence includes tension building, which is the first phase, that her experiences increase tension, victim minimizing problems. Tension becomes intolerable. Phase 2, the abusive incident, battery, highly abusive incident occurs. And phase 3 is the honeymoon phase, where they're apologetic, loving, and promise that they will change. Remember, they don't ever change. Here's the cycle of violence, so the tension building, the abusive incident, and then the honeymoon phase. Violence against women, battering during pregnancy, the rate ranges from 4 to 8% and may be as high as 20% in some populations. Incident of intimate partner violence may escalate during pregnancy and may happen for the first time during pregnancy. And the risk to the fetus includes increased rate of miscarriages, preterm births, and stillbirths. For the nurse, the assessment of the woman will start with the interview. So ways to encourage sharing information would be reflection, clarification, facilitation, empathetic responses, not confrontation, and interpretation. Assessment of the woman continues. Then you will obtain history like biographic data, reason for seeking care, the present health or health of present illness, any past health conditions, family history, screen for abuse, review of systems, and also the functional assessment. Be aware of cultural considerations and communications that vary. Trust that women are an expert of their own life, culture, and experience. And if asked with respect and genuine desire to learn, women will tell a nurse how to care for her. It may be considered inappropriate for women to disrobe completely for physical exam. This is prevalent in the Muslim culture, as well as some Asian cultures. In many cultures, a female examiner is preferred, so do remember that. Women with special needs, so women with disabilities, they could have emotional or physical disorders, vision or hearing impairments, adapt to each woman's needs. In some hospitals, there should be some ability to adapt to the woman's needs. Adolescents, age 13 to 19. Be aware of risky sexual behaviors, assess for eating disorders, and safety. The health screening for women across the lifespan. These are labs that are done throughout the lifespan. Common labs like hemoglobin, fasting, blood glucose, total blood cholesterol, lipid profile, urinalysis, syphilis, VRL or RPR are done during pregnancy. And other screening for sexually transmitted infections, mammograms, they change the guidelines often. 45 to 50 are usually when they start, unless there is a known problem. Tuberculosis screening testing, hearing and visual acuity, electrocardiograms, chest x-rays, pulmonary functions, fecal occult blood, flexible sigmoidoscopy, and bone density screenings. These are all labs that can be done across screenings for women across the lifespan, depending on the up-to-date guidelines. Laboratory and diagnostic test procedures continued. A test for HIV and hepatitis B and drug screening may be offered with informed consent in high-risk populations. Chapter 4 will talk about reproductive system concerns. Menstrual disorders include amenorrhea. Primary can be anatomic due to endocrine, chronic disease, eating disorders, and such medications. Secondary most often results of pregnancy, a clinical sign of a variety of disorders. Dysmenorrhea, pain during or shortly after menstruation. Primarily dysmenorrhea biochemical basis arises from the release of prostaglandins. Abnormally increased uterine activity. Alleviating the discomfort could include medications such as NSAIDs, heat, and alternative modalities. Premenstrual syndrome, PMS, is a cyclic symptoms occurring in the luteal phase of the menstrual cycle. PMS is a cluster of physical, psychological, and behavioral symptoms. It's poorly understood, and 30 to 80% of women experience these symptoms, and treatments can include diet changes, exercise, and herbal therapies. Premenstrual dysphoric disorder, or PMDD, is cyclic symptoms occurring in the last 7 to 10 days of the menstrual cycle. They have a severe variant of PMS with emphasis on mood affectation. Affects 3 to 8% of women, and treatment is similar to that of PMS, plus may warrant counseling, medications, alternative therapies such as hypnosis and acupuncture. Endometriosis is the presence and growth of endometrial tissue outside of the uterus. Major symptoms include painful periods or dysmenorrhea and deep pelvic dyspanuria, which is painful intercourse. Treatment includes drug therapy as well as surgical intervention. And once done with surgery with endometriosis, the scar tissue can grow back, so there may be a reason for multiple or other surgeries in the future. Infections include sexually transmitted infections, includes more than 25 infectious organisms transmitted sexually, 19 million people affected annually in the United States. Prevention is primary, if not secondary. Prevention strategies include safer sex practices, knowledge of your partner, reducing partner, low risk sexual activity, condom use, and vaccination. Vaccination, you would ask against hepatitis B as well as C. Excuse me, hepatitis B, not C. And hepatitis B, there's 3. You'll have the first vaccine at the first month, 1 to 2 months later, and again at 6 months. And there is a lot of people that aren't immune to hepatitis B, and they find out later in life with their checking their titers. Sexually transmitted bacterial infections include chlamydia, which is the most frequently reported STI. Infections are often silent and highly destructive and difficult to diagnose. Screening and diagnosis. Screening of asymptomatic and pregnant women are done, and comparison diagnostic procedures. Management would include an antibiotic or drug therapy. Gonorrhea, it's the oldest communicable disease. Aerobic and gram-negative diplococci. There is forms of gonorrhea that are harder to treat now. It has, probably because it has been around for so long, and the medication that has been given, so drug-resistant strains are on the rise. Women are often asymptomatic, and the management is treatment of antibiotic therapy. Like I said, drug-resistant strands are on the rise. Sexually transmitted bacterial infections continued. Syphilis, It's a modal spirochete transmission by entry into the subcutaneous tissue through microscopic abrasions. Transplacental transmission may occur at any time during pregnancy. So this is a STI that is screened before pregnancy and during pregnancy. Pelvic inflammatory disease results for ascending spread of microorganisms from the vagina and endocervix to the upper genital tract. It's caused by multiple organisms and most commonly involves the uterine tubes and the uterus, causing endometriosis and salpingitis. Sexually transmitted bacterial infections. PID is an increased risk for ectopic pregnancies, infertility, and chronic pelvic pain. Screening and diagnosis is done with history and CDC and routine criteria. Management is prevention, oral or parental therapy, bed rest, and education on the disease. HPV is the most prevalent viral STI seen in ambulatory healthcare settings, and it can cause genital warts as well as cancer. Symptoms: irritating vaginal discharge with itching, dyspanuria, postcoital bleeding. HPV screening and diagnosis is done with history of known exposure, physical inspection, and a pap smear. Testing for HPV is done with women 31 and above, because by women that can be infected before 31 usually clear the virus by 31. So once you're 31 and above, they will add they should, per the guidelines, add the HPV screening. Management: there's no therapy that has been shown to eradicate it, but medications are for discomfort, and counseling and education. HSV-1 is transmitted non-sexually, and HSV-2 is transmitted sexually. But there has been instances of HSV-1 found where HSV-2 is usually found. HSV, as the initial infection, is characterized by multiple painful lesions, fever, chills, malaise, and severe dysuria. A maternal infection can have adverse effects on both the mother and the fetus, increasing miscarriage rates during the first trimester of pregnancy. Association with cervical cancer has also been observed, and prevention is critical. Viral hepatitis. Hepatitis B virus is the most threatening to fetus and the neonate. It's a disease of the liver and often a silent infection. It's transmitted parentally, perinatally, orally, which is rare, and through intimate contact. And there is a series of vaccines for this virus. Hepatitis C virus. It's most commonly a blood-borne infection in the United States. Risk factors for pregnant women is history of injecting intravenous drugs. And like I said earlier, currently there is no vaccine for hepatitis C. There's medications to help people with the virus and that can help them with the virus. HIV is the heterosexual transmission now is the most common means of transmission in women. It's estimated that 23% of new infections occur in women, and transmission of HIV occurs primarily through exchange of body fluids. Pregnancy and HIV transmission to the infant may occur at any time. A definitive diagnosis of children less than 18 months is done based on lab evidence of HIV presence. Proper treatment leads to less than 1% transmission to the baby. Antiretroviral prophylaxis, triple drug antiviral therapy, and lab monitoring is conducted. Cesarean versus vaginal birth depends on the mother's viral load at the time of giving birth. Zika virus is spread through mosquito bites and sexual contact with semen. Read that again. Spread through mosquito bites as well as sexual contact with semen. that is infected. Infection increases the risk of microcephaly in infants. Avoid travel to areas with known cases, including the southeastern U.S., and use condoms with possible exposure by the male. Vaginal infections include vaginitis, an infection caused by a microorganism, also called abnormal vaginal discharge. Bacteriovaginosis is a syndrome in which normal hydrogen peroxide producing lactobacilli are replaced with high concentrations of anaerobic bacteria. It's associated with preterm labor and birth. Other vaginal infections include candidiasis or Candida albicans. It's a vulvovaginal candidiasis or yeast infections, the second most common type of vaginal infection. Predisposition includes recent antibiotic therapy, diabetes, pregnancy, obesity, diets high in refined sugars, use of corticosteroids, and also patients that have an immunosuppressed state. Other vaginal infections include trichomoniasis. It's a STI. It's a common cause of a vaginal infection. Screening and diagnosis. It's done with a specular examination and a pap smear. You will see the cervix has little, they call it a strawberry, little red patches all around the cervix. Management is metronidazole or tenodazole orally in a single dose. Group B streptococci or GBS is associated with poor pregnancy outcomes, an important factor in the neonatal morbidity and mortality, and your screening is done between 35 and 37 weeks of gestation. If a patient is GBS positive, she will receive antibiotics, a loading dose with 1 to 2 other doses prior to delivering the baby, and she is considered treated. Problems of the breast include cancer of the breast, incident in etiologies. 1 in 8 women are affected, and the risk increases with age. Even though there are several women, there are a lot of younger breast cancer patients nowadays. Prevention can include, really it's not prevention, because after you find out that you have breast cancer, then you would have chemotherapy. A screening includes mammogram, ultrasound, could be, if any of those are abnormal, maybe a needle biopsy, needle aspiration. Management. Cancer of breast management can include surgeries, chemotherapy, radiation, adjuvant hormonal therapy, and biologic targeted therapy, which is very common these days, the targeted therapy. Surgical management can include a lumpectomy, a total simple mastectomy, a radical mastectomy, and several different types of breast reconstruction. Chapter 5, Infertility, Contraception, and Abortion. Incidence of infertility affects 10 to 15% of reproductive age couples. Four goals when you're providing care would be providing the couple with accurate information, assisting in identifying the cause of infertility, providing emotional support, and guide and educate patients about forms of treatment. Assessment of the male infertility could include hormonal factors, testicle factors, commonly with patients who testicles had not descended in time or had issues with descent, sometimes have issues with male infertility because the sac is staying up closer into the body, which causes it to it's with the temperature. Descended testes, sometimes men can have problems with infertility. Factors associated with sperm transport, as well as idiopathic male infertility, so unknown. Assessments of female infertility test or examination include evaluation of the anatomy, detection of ovulation occurring, hormonal analysis, it could be ultrasound, an endometrial biopsy, or a laparoscopy. Assessment of the male infertility continued would be in semen analysis, hormonal analysis, as well as scrotal ultrasound. Plan of care and implementation, psychosocial considerations. You want to be aware of non-medical treatments such as herbal alternative methods, medical therapy, and surgical therapy that are available, like assisted reproductive therapies. Assisted reproductive therapies include in vitro fertilization, embryo transfer, a therapeutic donor insemination, and embryo hosting, such as surrogacy. Reproductive alternatives can include surrogacy, pre-implantation, genetic diagnosis, adoption, and cryopreservation of human embryos. Contraception is the intentional prevention of pregnancy. Birth control is a device of practice to decrease the risk of conceiving. Family planning is the conscious decision on when to conceive or avoid pregnancy, and you still may be at risk for pregnancy, and nearly half of U.S. pregnancies are unplanned. Care management, a multidisciplinary approach to assist the woman in choosing an appropriate contraceptive method. Ideally, when choosing the contraceptive method, it should be safe, readily available, economical for the woman, acceptable, and simple to use. Contraceptive choice must be personal, social, cultural, and provide interpersonal needs. Methods of contraception that don't necessarily work as coitus interruptus, which is the withdrawal prior to ejaculation. Fertility awareness methods rely on avoidance of intercourse during fertile periods. Combine charting menstrual cycles with abstinence and other contraceptive methods. Natural family planning, which is a period of abstinence, or calendar, as well as calendar rhythm method. A standard days method, there's a basal body temperature method, testing the temperature, and predictor kits available for ovulation, and also the belief of breastfeeding. Here's a picture to give you an idea of the ovulation cycle, testing the temperature. Barrier methods include spermicides, condoms, vaginal sheath, diaphragms, cervical caps, and contraceptive sponges. Just be aware of the several contraceptions available. Here's a picture of picture of the condom, the vaginal, I think it's vaginal cap. Hormonal methods, combined estrogen, progesterone contraceptives, can be oral contraceptives. Be aware of the side effects, transdermal contraceptive systems, and vaginal ring. Progesterone-only contraceptives are an oral progestins, the mini pill, injectable progestins, implantable progestins like Norplant. Emergency contraception is used within 72 hours of unprotected intercourse. There's 5 methods available in the United States. High doses of estrogen and birth control pills, 3 options, 2 days of levonorgestrel, and insertion of the copper IUD. IUDs are the small T-shaped device wrapped in a copper inserted into the uterine cavity. It's medicated intrauterine system loaded with progestational agents such like the Mirena. The IUD offers no protection. The IUD offers no protection against HIV or STIs. Here's a picture of the IUDs. Methods of contraception continued. Sterilization. Female can have her tubes occluded, and they can also be, once they're tied, they can be untied. But once, so that's the reconstruction. Male vasectomy can be reversed, but it does not guarantee that you can get pregnant or he can get someone pregnant. Same with the tubal reconstruction. Abortion is the purpose of an interruption of pregnancy before 20 weeks of gestation. It can be done electively or therapeutic due to known issues. Contributing factors. Legal and moral issues include Roe versus Wade from 1973. First trimester abortion is done with surgical aspiration. Medical abortion such as methotrexate or misoprostol. Second trimester abortion is done with a DNC or dilation and evacuation, cervical preparation with prostaglandins. Got to be aware of the emotional considerations of a second trimester abortion. Induced abortion performed in the first trimester is safest and less complex, and common complications after abortion include infection, retained products of conception, and excessive vaginal bleeding. Chapter 6, Genetics, Conception, and Fetal Development. Genetics provide the tools to determine the hereditary component of many diseases. It improves our ability to predict susceptibility, onset, progression, and response to treatment, and is a gradual shift from genetics to genomics. Genetic diseases affect people of all ages, socioeconomic levels, and racial and ethnic backgrounds. Genetic diseases affect individuals, families, communities, and society. Advances in genetic testing and genetically based treatments have altered care. Nursing expertise in genetics and genomics expanded roles. Preconception counseling and testing. Could be neonatal genetic screening and testing. Palliative care for infants with life-threatening conditions. Identifying and caring for individuals with genetic conditions. Specialized care of women with genetic conditions during pregnancy, such as congenital heart disease, cystic fibrosis, factor V Leiden. Essential competencies. Essential nursing competencies and curricula. Guidelines for genetics and genomics. Constructs pedigree from collected family history information. Develops plan of care that incorporates the genetic assessment. Provides patients with genetic information, resources, and services. Facilitates referrals for specialized services that may be needed, and evaluates the impact and effectiveness of genetic and genomic technology interventions and treatments. Roles for nurses with genetics and genomics expertise are developing in the prenatal screening, carrier testing, newborn screening, palliative care, identification and care of individual and families, and specialty care during pregnancy. Genetic testing is done with direct or molecular testing, linkage analysis, biochemical testing, cytogenic testing, prenatal testing, so maternal serum screening, fetal ultrasound, amniocentesis, or chorionic villus sampling. Genetic testing, test carrier screening test, predictive testing, pre-symptomatic testing, predispositional testing, and population-based screenings, pharmacogenomics, and gene therapy or gene transfer. Ethical, legal, and social implications. Privacy and fairness is in use and interpretation of genetic information. Clinical integration of new genetic technologies, and issues such as possible discrimination and stigmatisms. Factors influencing decisions to undergo genetic testing are seldom autonomous and based on feelings of and commitment to others, socioeconomic factors, and culture and ethnic differences. Clinical genetics, the genes and chromosomes, so the DNA, chromosomes, genes. I'm not going to spend a lot of time on the genetics since it's not necessarily going to be on some of the stuff that I'm testing. It's not going to be, I'm not going to go deep into it. Genes and chromosomes. Chromosomal abnormalities are a major cause of reproductive loss. Congenital problems and gynecological disorders can occur during mitosis or meiosis. Chromosomal abnormalities, so autosomal abnormalities, include Down syndrome, and abnormalities of chromosome structure can be translocation, reciprocal translocation, balanced translocation, or Robertsonian translocation. Sex chromosome abnormalities such as Turner syndrome is monosomy X, and Klinefelter's syndrome is trisomy XXY. Patterns of genetic transmission is unifactorial, a single gene controlling a trait, disorder, or defect. Multifactorial is the most common genetic malfunction. It's a combination of environmental and genetic factors which could cause cleft lip and palate, congenital heart disease, neural tube defects, and pyloric stenosis. Here's risk factors for genetic disorders, screening that would be done, questionnaires that would be done. Genetic counseling is the standard practice in obstetrics, and the goal is to identify any risk. Genetic history should be obtained using a questionnaire or checklist, and genetic counseling would be done with information, education, and support. Estimation of risk is the occurrence of risk, so if the parents are known to have a risk for producing a child with a disease, and then reoccurrence risk is once they have already produced a child with disease. Roles for the nurses would be identifying families in need of genetic counseling, collaborate to help make referrals, emotional support, and the nurses would need a working knowledge of such, awareness of recent advances in genetics, and understanding of possible effects on families. Cell division and conception, cell division, mitosis, meiosis, gametogenesis, spermatogenesis, oogenesis, conception, ovum, and sperm. It's a picture of the sperm and the ovum. Cell division and conception, fertilization, implantation, primary germ layers is the ectoderm, the mesoderm, so embryo and fetus. The primary germ layers are the ectoderm, mesoderm, and endoderm. The development of the embryo, membranes, the chorium, amnio, and amniotic cavity. Amniotic fluid serves for numerous functions. The volume is important to the fetal well-being. The yolk sac becomes primitive digestive system, and the umbilical cord supplies the embryo with maternal nutrients and oxygen. Here's a picture of the bottom A, B, C. C is where the fetus will be housed. B is showing the umbilical cord attached to the placenta. And A is showing where the placenta would be attached to the uterus. The placenta structure: maternal placenta, embryonic circulation by day 17, and the function is endocrine, gland, metabolic function and waste, and nutrient storage. Showing the placenta attached to the uterus. And remember, with the placenta, there's one vein and two arteries. HCG, where it increases with gestation at the beginning. Fetal maturation: the viability, the capability of the fetus to survive outside the uterus. Limitation are based on central nervous system function and oxygenation capability of the lungs. So fetal circulation systems: the fetal heart rate runs between 110 and 160 beats per minute. I'm sure if you guys have already been to clinical with the infants, you will hear how hard it is to count their heart rate. Fetal maturation: so hematopoietic system, the respiratory system, so primary surfactants, the gastrointestinal system, hepatic system, and the renal system. This is showing a twins with their own separate placentas and fetal maturation: neurological system, sensory awareness, endocrine, reproductive, musculoskeletal, integumentary, and the immunologic system. Multifetal pregnancies: so twins can be dizygote twins, monozygote, or conjoined. Is a picture of two, looks like one sac with two both the placentas. Monozygote, dizygote, and conjoined. Embryonic fetal development, showing you when the neural tube defects happen, the upper limbs, the lower limbs, the ears, the eyes, the teeth, the external genitalia is between weeks 9, starts about half of week 9. And the purple is the highly sensitive period. So you can see that's all before, week 9. Non-genetic factors that influence development of the fetus would be tetragens, such as drugs, chemicals, infections, exposure to radiations, and maternal conditions. Maternal nutrition, such as malnutrition. And that concludes chapter 3, 4, 5, and 6. You're responsible to read over ATI 1, 2, and 8, and reading for next week would include textbook 7 through 10, 7, 8, 9, and 10, and ATI chapters 3, 4, 5, 7, 9, and 10. Your first test will be on the 3rd week. Very important for this class for you to read over your ATI as well as your chapters to make you successful for this class. In the coming weeks, I will also attach some videos to give you some more information on what we're reading over, to kind of pull everything together with a visual. And I look forward to talking with you guys next week. Have a good week. Make sure you're doing your reading and be prepared for class. We have I think it's two possible quizzes in the coming weeks. Have a good night.